Good morning, everybody. Good morning, everybody, and welcome to AM Impact on Your Health. AM Impact on Your Health, where every day our goal is to have you learn at least one thing to help you live better and longer. AM Impact on Your Health is heard each and every Monday, Wednesday, and Friday from 8 to 9 o'clock. I'm Dr. Dennis Courtney, and I'm with you each and every Monday, Wednesday, and Friday from 8 to 9. AM Impact on Your Health, for each day you'll find current medical news, knowledgeable guests, fascinating health topics, and of course, we'll encourage you to call in to join in. Today, well, folks, it is I believe, the last gathering of the Freedom of Choice in Cancer Therapy group. It's this week. It's a little off-key because it's not the third Thursday. It'll be the second Thursday. However, they are going to hold this at the venue that you've come to know as the New Place in Oakmont, PA, at Riverside Landings. They're going to be meeting up there on Thursday at 7 o'clock to meet a young doctor with a new way of talking, a pretty fancy way of talking, if I might add. He is an expert in something called functional medicine. I'm always interested in these new monikers, but I'd like to learn a lot with you about functional medicine today. He's our guest today. Dr. David Loeber is going to be with us for the entire hour, and we're going to find out what he can tell us about functional medicine and how he may be able to entice you to learn more to become a member of the audience on Thursday night. Now, that's the way it usually works around here. We get the guest in the same week that he's going to be out there meeting you and have an opportunity to let you learn a bit about what his topic will be. Functional medicine is the topic. I'm all ears today on what I can learn about functional medicine also. So, if our discussion and during our discussion with Dr. Loeber, you want to call in to ask a question or make a comment, the number, of course, as always, is and will be, that's 412-825-6262. That's 412-825-6262. I will give that number additionally throughout the hour. Now, let's see how the rest of the month is shaping up. We've had an action-packed May. We're well into June now. And on Wednesday, we're going to be having our monthly our monthly encounter with Dr. Vava Vavoom herself. Dr. Susan Smith-Jones will be back. She's a little bit out of sequence, too. She usually comes here the first Wednesday of the month, and this will be the second. But she's always got interesting things to tell us. We'll find out what they are on Wednesday morning when Dr. Susan Smith-Jones returns to the airway once again. Then next Wednesday, Dr. David Minkoff is going to be here. He's a specialist in the treatment of Lyme's disease. I would have thought he'd probably be best to be based in Pennsylvania. He says, no, Clearwater, Florida is where his base of operation is. But he handles Lyme's disease and takes it very personally and has a tremendous track record in reversing it over a contracted and compact period of time. I call him the gunslinger because he's so, anything goes, whatever it takes to win, and the patients are the benefactors of that aggressive approach. Dr. David Minkoff will be our guest on the 17th. You'll enjoy hearing from him. A lot of things, eyes are going on, if you can't tell. A lot of topics that we've had over the last month have related to the eyes. We, I think, cracked it, if we could use a little bit of a slang term. I think we cracked it, folks. The issue of cataracts was one that was a 50-50 shot around here. I think we changed the entire course of the events as they are now going to be coming at you. Of course, we really enjoyed our show with Dr. Lisa Bowen last Wednesday, our go-to eye doctor, who was pretty instructive about how effective the 4-day cataract treatment program was for those first few patients that happened to move through it. I believe that wasn't a fluke. I believe that's in fact what we can expect. And if that is anywhere near 100%, as it turns out, I'll be extremely grateful and thankful, and so you too. So I'm putting together a disc net right now. I know which ones of the previous shows I want to put together to make the disc that will tell the entire story, get ready for it. The moment I have it available for you to purchase, I'll let you know. And you'll probably want to have this as one of those collector's pieces. You know how that works. Anyway, the Dr. Lisa Bowen show of last Wednesday. You can go listen to it in the archives at any time by just dialing us up by going to djcmd.com. That's the website. On the opening page, click on the icon that's marked Archives. Once you do that, you're taken right onto YouTube, and all of my shows are there. Just scroll on back to last Wednesday, June 3rd, and enjoy it. Understanding that I'm going to be putting a disc together with a number of shows, all that took place from the month of May forward to this present date. I'll let you know when that's available. Speaking of the eye program, we're moving toward the June eye program that we'll be holding in the office here in the week of the 22nd, 3rd, 4th, and 5th. Now, if you have retinal issues, you know, that's the MACD issue, macular degeneration, or glaucoma, diabetic retinopathy, or a whole host of other anomalies that can be ascribed to the retina. You'll want to be involved in the retinal program. And if you have cataracts, you may want to be in the second group of the cataract treatment program that works so effectively for those first that came through. Give us a call here. Check us out at the website. Go to pittsburgheyeprotocol.com. That's pittsburgheyeprotocol.com. And you can read about our pretty interesting little clinic here. We are the northern affiliate of the Dr. Ed Conrad Healing the Eye and Wellness Center. He developed these programs a number of years ago. He has conveyed the art to us here. He's involved with every case here as an ophthalmologist. No one can actually meet his level of expertise when it comes to an alternative approach, a non-drug, a non-injectable, a non-drug, an invasive approach to treating some pretty serious problems that even in the realm of treatments, there are no treatments for. And forget about that surgery with that eye thing, you know, the cataracts. Looks like we're able to beat that too. Anyway, more up and coming. If you think you're interested in the eye protocol and you'd like to be a member of this particular group, you can give us a call at 724-993-0500. That's 724-993-0500. You want to talk to Sister Sarah to get enrolled. And just for those who need a little further, it's summertime, folks. People are taking vacations. They're moving all over across the country. The July Eye Protocol will be held the week of the 20th to the 23rd. So either make it this month or next. I don't have an August date yet, but I'll let you know when it's in the offing, and I'll pretty much take care of the entire summer groups. Looks like I'm going to be at some place called Strabane Trails Village at that's on the last day of the month, June 30th. I'll be talking about eyes, so it's sort of a free eye seminar. Call in and talk to Sister Sarah to get more information about if you live in the South Hills, Washington County area, near Cannonsburg, that kind of a thing, and you think you'd like to be involved in a free seminar that's in your backyard. Give us a call at 724-993-0500, and we'll try to get you steered in to that up-and-coming event. What else? Oh, the vitamin C kits, folks. They are here. They are available. If you do vitamin C and you have learned the Courtney approach, you know there's two rules. What are the two rules? The two Courtney rules are you better get non-corn derived vitamin C. That's the first of the two rules. The second is, to be smart about it, you better get a liposoluble, fat-soluble form of vitamin C, or you're not going to be absorbing anywhere near what you're going to be taking in. That's the little problem with the intestinal mucosa. It does not readily accept water-soluble material, and vitamin C is certainly all that. 3% on a good day, 3% of what you take in is all you're able to absorb. So what you want to do is be able to take a form of vitamin C that will pass through the mucosal barrier. It's got to be liposomal to do that. You can purchase commercially prepared vitamin C excellent products. We carry them. We continue to carry them now. I guess the two are Ultra Absorbing C. I just heard from Sir Arnold Takimoto telling me he's finally solved the issue with the bottles. There's some problem with the caps, and whenever we got a shipment, half of the doggone caps had vitamin C that was emanating from it. Couldn't make the trip. However, it makes it with an airplane. It didn't seem to work. He claims he has it conquered. So Ultra Absorbing C from Bioimmune, as well as a product from Quicksilver, are the commercially prepared ones. You can make your own, however, with a kit we put together a while back, which we now offer to you if you'd like to. Make your own and do it for pennies a dose, which I think is a great inducement. We've got a citrus-derived form of vitamin C and a non-soy-derived form of lecithin. You'll have to mix them together, but if you do so, you'll save a tremendous amount of money. Plus, you'll need I know it sounds weird, you're going to need an ultrasonic jewelry cleaner to congeal the two. Anyway, full instructions are available if you want to find out more. Give us a call here at 724-942-3002. That's 724-942-3002. And looks like that wraps that one up. Beresha reports, we'll have one this week, I'm sure, with an up-and-coming meeting and tasting available in western Pennsylvania somewhere, I can tell you that. What else? Oh, I think that about rounds it out, folks. So let's do this. We're going to take a short break. In the interim, we're going to meet a gentleman that you have an opportunity to see in the flesh, face-to-face this week. He's going to be the featured speaker at the Freedom of Choice and Cancer Therapy Group. Going to be holding that event at the Riverside Landings in Oakmont at 7 o'clock on Thursday night. He's going to be talking about a form of medicine that he represents. It's called functional medicine. I've heard the term before. I'm going to be honest with you. I'm going to learn as much today as you are. What the heck is functional medicine? This is the guy that I don't know. His name is Dr. David Loeber. He is our guest today and your speaker on Thursday night. Be right back in a moment with Dr. Loeber. Good morning, ladies and gentlemen. Welcome back once again to AIM Impact on Your Health. Heard here on KHB 620 each and every Monday, Wednesday, and Friday from 8 to 9 o'clock. I'm Dr. Dennis Courtney with you today on the Monday morning version of the show, and it's the week, folks. It's the week that things happen out there in Oakmont with the Freedom of Choice and Cancer Therapy Group. Now, they took a 1 month hiatus where they went back to Butler sort of returning to the scene of the crime. 40 years worth of an anniversary was held last month. We're now back at the standard new venue of Oakmont, and each and every month, for quite a while now, they've been offering the ability for you to meet interesting people who deal with conventional, unconventional medicine. And in this case, you got a real winner, folks. A new form of medicine that you're going to learn about through a gentleman who I don't know. Now, he is a medical doctor. He is trained in, I'm going to guess, trained in the use of functional medicine or to acquire this on his own. We'll learn more about that in a moment. But you have a chance to see him in the flesh, face-to-face, up there a Thursday night. We're hoping that we can titillate you a bit in order to make that trip. Hope to see you there. His name is Dr. David Loeber. He is our guest today. Let's say good morning, Dr. Loeber, and welcome aboard.
Good morning, Dennis. Thank you for having me on today.
I really enjoy having you on today. I intend to learn as much as I can because I have to admit, I'm a little shy when it comes to explaining a functional medicine, but I hope before the hour is up, you'll be able to enrich me in such a way that I feel a little more comfortable about this topic. You, as a medical doctor, are now practicing, I'm going to presume, in the world of functional medicine. Let's take a bit of a stroll in your past. How is it that you've arrived to the point today? Is medicine your first avocation, your first career? And within it, how did you know that you wanted to do something called functional medicine?
Great. So functional medicine is something that some 5 years ago I had no idea what it was. I knew in me that that's what the kind of medicine I wanted to practice, but I wasn't quite ready to put words to what it was. To describe my background, medicine kind of runs in the family. My dad and my uncle both being docs, my mom and my sister being nurses. It's something that, from an early age that I always kind of aspired to. I admired the way my dad cared for people and the respect that he had, and I really gravitated towards that. I took a couple turns along the way. I spread my wings. I studied in Japan a little bit and expanded my horizons and came back to medicine. And I was very conventionally trained. I went through Jefferson Medical College out in Philadelphia and got my MD degree in 2008. Came back home to Pittsburgh and training residency at the UPMC Presby Shadyside. And all along the way, my beliefs in how to care for people never changed, but I just saw around me that the people that I was caring for didn't seem to be getting better. Many different therapies, kept on coming back to the hospital, kept on coming back to the clinic. I felt like there was a disconnect somewhere. There was some piece of the puzzle missing. And it really wasn't until my wife and I, we got pregnant with our first child in 2010 that we started to look in a different direction. We, at that point, made a conscious effort to find out what do we need to do to help bring our child into this world as best as possible. How can we change our lifestyle? How can we change our environment? And we ended up, going down the organic food route. Beforehand, we were quite encamped in the standard American diet. And the process of changing our lives really opened up my eyes and helped me realize that some of the things we're doing, a lot of the things we're doing in our society are not beneficial to our health. And going through the process, we wanted to have as natural birth as possible in the hospital setting. Very much me being conventionally trained, I was quite nervous to go down any other route but the one that was laid out before me. But in the process of having our child and going to the hospital, there were certain things we did and did not want to do. We wanted to have natural birth if possible, not use these medications, like Pitocin and epidurals, because from our research we found out that these things can have adverse effects. It can induce fetal distress. It can lead to complications, which can lead to C-sections, which can lead to a whole host of problems. So it was really this experience from us bringing new life into the world that I began to realize that maybe the conventional way of doing things in medicine wasn't always the best way. our wishes, though we had a beautiful child, our wishes weren't quite as respected. We had Pitocin, we had IV fluids, we had monitors. My wife had to push a certain way, and she had to push before she was ready, and she ended up tearing. And it was just a series of events that had these little glitches in the matrix for me. That maybe there's another way. There's another way of doing things, which focuses on our natural physiology. It gets down to the root causes of, how we should practice medicine. And that, over the years, I continued to work in hospital medicine, and I had an interest in doing oncology for a long time. And, along the way, in the rigmarole of the industry and the way things were done and the commercialization of cancer products, it really made me think that this isn't my calling. I need to get back to these roots. I need to find out there's other things in life that are, just like this birth experience. Are there things in medicine that we can do better? And we focus more on, the root causes to keep people from coming back into the hospital, to really, stop treating the signs and symptoms of diseases and getting to the root causes of diseases. And that's how I came across functional medicine. I remember watching the episode of Dr. Oz, and he featured some prominent functional medicine practitioners. He called them disease detectives, was the name of the episode. Luminaries such as Dr. Mark Hyman and Dr. David Perlmutter, who I was pretty impressed by the fact that you could cure these incurable diseases by modifying the diet, altering the microbiome to promote stress reduction, elimination, and detoxification of the 80,000 some odd chemicals that have been quote unquote approved for our society. And dysfunctional medicine became the words what I was striving to find. And functional medicine is root cause medicine. It's looking how the modifiable, personalized lifestyle environmental factors play a key role in influencing our genes from the environment, the concept known as epigenetics, and how and the functional medicine provides a systemic way of synthesizing information, gathering, organizing it, really getting to know patients on an intimate personal level and beyond the time of constraints of modern medicine in our 40-minute to 20-minute appointment windows. It takes much more than time than that to help people, to educate people, to let them know, what's going on in our world. And I'm sure the Latin for doctor is teacher. And I think that's what we need more of in this day of age. And the advent of chronic diseases just going and skyrocketing. There needs to be a better way from a financial perspective, from a patient perspective, from a humane perspective. And I think I know functional medicine is the answer to this. And I'm so glad that I got into it. And to answer your questions, I started training on my own as I worked as a hospital doc. And there's the Institute of Functional Medicine, which is the foremost purveyor of functional medicine education, and is started by the luminaries in the early 90s who put all this together. And I've been training over the last year and continue to train to really maximize my knowledge and expertise in this area. And I've just opened up a practice. I'm really excited to share it with the world, and really looking forward to the talk coming up on Thursday.
Sounds like a great path to get you here. Alas, what I thought may have happened turned out not to be the case. I actually thought there was a school that was teaching this, some conventional medical program. But once again, you looked at what you were taught and found it really wasn't able to match up. I think maybe in that respect, you and I have a similar background. We saw a whole body of facts that we were taught to use just be nothing but failure, and we decided to take another tact. You call this functional medicine. Certainly, we're going to explore that. But you went and learned it on your own. You just knew you weren't in the cards to continue doing what your training taught you to do. There had to be a better way, I guess is a simple way of saying it. And you found that there's some training available for you in this thing called the Institute of Functional Medicine. Who are they, by the way? Who's the Institute of Functional Medicine?
Well, the Institute of Functional Medicine is, the group of docs. I think it was about 7 or 8 of them that gathered in their early 90s, and it was from all walks of life. And functional medicine is not restricted to medical doctors. I think having this medical training offers a very unique perspective. It allows me to kind of bridge the gaps between two worlds. But naturopaths, chiropractors, dietitians, nurses, they're all can be, trained in the functional sense. And I think the medical doctor doing this can offer a very, robust and diverse background to treat patients. But this company, and there are other ways of learning the functional medicine. I think the other groups and teachings out there, stem from this particular institute. They are the forefathers, and the most prominent luminaries I mentioned: Mark Hyman, David Perlmutter, there's a physician, Dr. Amy Myers, and Dr. Jeffrey Bland. It's very impactful people that I attend seminars and classes and travel extensively and do tons of reading on my own, and really to bring this movement, this new way of thinking, this new paradigm to our medical industry. And it just makes sense, putting the patients at the core, really individualizing care, to integrate best practices from all, worthwhile disciplines that promote how we can, improve the lifestyle, environmental factors that are impacting our health. And with diet and nutrition being at the forefront of these things. So the Functional Medicine Institute is a great resource. They have a website. You can learn much more information about functional medicine and find out about practitioners that are throughout all areas, including myself.
Yeah, now that you mentioned some of the luminaries there, quite honestly, some of those are personal friends of mine. Jeffrey got this all going up there in the state of Washington a number of years ago, and it's continued to attract the David Perlman of this world, the real brilliant folks from other areas, a neurologist, a board-certified neurologist. You talk about him making a turn away from the conventional world. But there's a lot to be learned from the Jeffrey Blands and David Perlmutters of this form of medicine. And as you continue this tract, you'll do nothing but grow more and more and more. You appear to be on the precipice of launching and opening a new practice, and there'll be plenty of folks that will be interested in what you have to say, Doctor. Let's take this thing about functional medicine. And you mentioned there are 6 core principles. Now, we don't have to get completely down the weeds, but so that the listeners can get a taste for the foundation of functional medicine, do you mind walking through us through a few of these core principles and illuminating and maybe expanding on them just a bit?
Of course. So to start off with, number 1, an understanding of the biochemical individuality of each human being based on the concept of genetic and environmental uniqueness. So we all have a set of genes that we inherit, but the fact of the matter is, our genes do not dictate who we are. Of course, there's a few those conditions out there that, trisomy 21, that it's hard to get around those kinds of things, but the vast majority of our diseases and that predispose to chronic illness are rooted in our environment, in how nutrition, stress, microorganisms, environmental pollutants, our levels of sleep and relaxation influence these genes. There's a particular gene mutation, MTHFR, that I have treated patients and have family members who have this, and this is a defect in DNA metabolism. It's a defect in production of glutathione, a key antioxidant in our bodies. It's a defection in how we can optimally produce our neurotransmitters. And realizing that this mutation's out there, and realizing that the folic acid that is in our synthetically derived folic acid is not optimal in our pathways to use, and without the proper amount of folic acid, activated folate, we've got toxic accumulations of synthetic folic acid. We're not producing our DNA. We're not having our repair mechanisms as well, and we're not functioning at our highest levels. So by working with patients from the environment, their food that they're eating, and putting that with their genetics, and we can do this with another number of diseases, it really speaks to individuality and uniqueness in the approach of functional medicine. So that is definitely one of the main things.
Do you find that you need, and do you incorporate genetic testing as part of your workup?
When it dictates. I had a patient who was in her early 60s without any significant coronary risk factors, who all of a sudden had a heart attack, and she's wearing a life vest. And so, with someone like that, yes, if there's a reason to find out if they're genetically predisposed to having some form of vascular inflammation or hyperlipidemia or the NTHFR and increased inflammation. These are the people that when I see them, I will incorporate genetic testing, and that's the wave of the future. You mentioned Dr. Bland and his personalized lifestyle medicine institute, and genetics and personalized care is what we're going towards. And and we just had a conference in IFM devoted solely to that just a few weeks ago. So I am of the mindset I will use all and any best tools at my disposal to help patients out at the core level.
Perfect. Let's move to another concept. Number two, some awareness that moves towards patient-centered rather than disease-centered approaches to treatment. Take that one for a moment.
Yeah. So what I always try and explain to patients when I first meet them is about what functional medicine really is. Imagine a tree, if you will. And the top of the tree is filled with many branches. We've got our neurology branch, our urology, pulmonary, cardiology, oncology. They're all vast branches that the accumulation of our core, of the trunk of our physiology and the roots of the personalized lifestyle, environmental factors. So high in the trees, sometimes we get some rotten fruit, and this fruit needs to be picked off. And eventually, there's many different ways of diagnosing exactly what's wrong with the fruit, and surgically removing fruit to give medicines to get rid of the fruit. But then, lo and behold, most of the time we can't get rid of this fruit because we're not correcting the soil. We're not correcting the things that are impacting the health of us as a whole. So I think that this speaks to this awareness that a patient-centered, we need to focus on the core, the roots of what's going on in a patient's life, and not the disease which is the manifestation at the very top, the tip of the iceberg, if you will. I'm interested in getting below the surface and chipping away at the huge amount of burden from the root causes of nutrition, exercise, stress, the microbiome, pollutants, exposures. These are the things that I feel bring about a patient-centered approach rather than the disease. If you treat the patient, if you get the root cause, the disease will be nothing to worry about.
Yeah, you can't spray that rotten fruit up on the top. You're so right. You had to head to the soil and take it from the bottom up. And that analogy is creates and conjures up an image that's easily appreciated by the listener, and certainly I've got that thing locked in my mind as you've described it. Let's move on to talk about this balance between the internal and the external body, mind, spirit, which is a third core principle of this functional medicine.
Sure. So we are not islands unto ourselves. We are influenced by ourselves, our relationships with others, and how our body interacts with our environment. And it's this core principle that you can't just treat the roots without treating the environment as well. The stress, I think the CDC, of all things, say that 85% of diseases can have an emotional impact. Stress can disturb our physiology, can weaken our immune system. It can, increase our cortisol, which can increase chronic inflammation, which is the linchpin for all diseases that we experience. It's about finding that balance and finding ways to deal with stress in the environment, maximizing prayer, yoga, relationships, meditation. We use essential oils in our family, anything that can bring that inner balance. And it's key to have that, because if you don't have that, then you're not going to be able to treat the whole person.
Well said. How about these physiological factors and their interconnection to them? Talking about, well, maybe you better tell me, how do you meet that particular core principle, these interconnections?
So one of my least favorite medications is proton pump inhibitors. Proton pump inhibitors are in the end treatment for a wide variety of symptoms of heartburn, indigestion. So it's about looking deeper than that, looking deeper than just treating the symptom. It's about going and diving deep to the root cause. And irritable bowel and reflux are newfound epidemics in our society. Many, many, many patients are on these drugs. But the fact of the matter is that, and let me walk you through these physiological steps. We eat a diet that's high in processed sugar and carbohydrates, which feeds 100 trillion microorganisms that reside within our gut. These organisms thrive on such a diet, and they grow and multiply, and they release excess gas and overgrowth, which causes us to have physical pains, indigestion, manifested as reflux in the end form. Now, taking a proton pump inhibitor, sure, maybe it helps the symptoms a little bit, but what are we doing? We're disturbing the natural pH balance of our acid in our stomach. And guess what? If we lower the pH, increase the pH of our stomach acid, we're actually forming an environment which makes it more predisposed for these types of organisms to live in the first place. We are aiding and abetting poor physiology with the use of these PPIs. It's a vicious circle that keeps on promulgating in our world. And instead of getting to the root cause of maximizing the diet, reducing the carbs, using probiotics, getting the gut back in balance, these are the things that these interconnections of physiology which are not even thought about in conventional medicine. And these are the things that I focus on, and that's that's how functional medicine differs. We go down deeper, we get below the surface, we get to the roots, and that's just one example of such a discipline.
That's a great example too, and we have a whole medical industry built on the use of over-acidic, claiming that it's an over-acidic situation. We need to put the fire out. It sounds simplistic, it sounds right, but it's the complete backwards approach to correcting the problem, where more than likely it's more acid that's needed, not less. And great description there, by the way, Doctor. Great description. We move on talking about the identification of health as a positive vitality. Maybe you better take that, because it seems a little too vague for me to even delve into that one. What is meant by this positive vitality, not just the absence of disease? Take it.
So positive vitality is really empowering patients, empowering people to have control over themselves and their physiology, to make them realize that there's things that I can do with the way I eat, with the amount of sleep I get, with the supplements that I take, with the environment around me, and detoxifying from chemicals and GMOs and pesticides and our water supply. It's about empowering people. And that's the beauty of functional medicine, is that I'm just the gatekeeper. It's the patient who are making these changes. I'm just impressed and amazed by the works of my functional medicine practitioners who came before me, and to make them. I saw an example of an autistic child who couldn't speak, couldn't write, and we got him on a regimen of B12, folate, reduced carbohydrates, use of probiotics, optimal supplementation. Within a matter of months, this child was clinically improving, could write, could speak. He was an interactive person. So it's about empowering people. That's what I feel represents the vitality, and it's amazing what functional medicine can do.
Well, you notice that in the last of the 6 core principles that there is an awareness of quality of life and health, not just lifespan, that and the number of years that you live, but how much quality you have with those years. Did I catch that one right? Does that pretty much round out the sixth one?
Exactly. And, you could have, I've seen patients, you have a 90-year-old who's bedridden, multiple sores, lymphedema, increased vasculopathy, who are not doing well, versus a 90-year-old who's up and walking and exercising and talking, and you wouldn't even know that they're 90. Age is just but a number, but how we feel and our physiology and who we are is how we should measure our quality of life. And again, I keep going back to the root causes, and it's really the focus of my care and in functional medicine. It's how do we address everyone's individual set of circumstances. And I take a lot of time. I take 90 minutes, an initial appointment, and even more time beyond that to really delve into the 25-page questionnaire that I send out that gets down to the core of who people are. And it's not an easy process. It's not easy for the patient. It's not easy for me, but the rewards are so significant. And to really get to the core of what's going on in your life and to empower them to make the right changes, to be the healthiest person they can be. And that's the goal of functional medicine.
Now, Doctor, it's quite obvious to me that you are a renegade, that you really are so far askew of what your training taught you that within the context of your own practice, did you see do insurance companies hassle you at all with how you perform what you do? Because this is antithetical to in what way medicine is supposed to be practiced. That I see a problem here. You're not going to be really looked on as having an approved approach to treating doctors. Are you comfortable with the fact that you are a renegade and will continue to be one?
Oh, but most certainly. Dr. Perlmutter often says himself that he's glad that he's out on the limb, which means he's doing something right. And I like to think I'm on a limb too, and this is a limb worth walking out with me on. And to insurance, you're right. We have a whole industry that is more concerned about the length of stay, appointment times, maximizing your ability to see as many patients as possible. And that flies in stark face to conventional medicine. And functional medicine, I've kind of taken myself out of the loop. I'm not accepting insurance because of those reasons. I'm devoted to caring for patients as best as possible. And to do that, I need to do medicine differently. I need to approach how I care for patients and the service I provide in a different manner. So there is a cash fee that we charge, but that is, I think, more than reflective of the way that we need to do things a little differently. And if you're interested in a different approach, if chronic disease has been something that's been plaguing you, if you want to maximize your own self, to empower yourself, I think functional medicine is the way to go. And I've found in my short time that there's a lot of people who are hunger and driving for those things, who've expressed their doubts and concerns about the status quo when it comes to management of chronic diseases. And so functional medicine it's different. It's a trailblazer, and I think it's the wave of the future.
Now, you mentioned very early on in our discussion you had an avocation or something that attracted you in oncology. And, geez, in my opinion, if there ever is a blemish on the face of conventional medicine, this conventional oncology approach probably could be considered to be criminal, and you actually should be put in jail for it. To think that those roots are where you come from, maybe you should spend a little bit of time talking about how that avocation maybe is turned into an approach, because I think you do move toward treating cancer or patients who have cancer with a functional medicine approach. All started way back when you thought you wanted to do this in a conventional way, huh?
Right, so it's probably the most prominent influence on me. I lost my dad at an early age to cancer. He was in his 40s when he was diagnosed, and he went through the conventional process. He did well for a while, and fortunately the cancer resurfaced, and he lost his life when I was in medical school. And it was difficult. It was intensely impactful on me. I felt that if I, devoted myself to, caring for patients and with the care and compassion that my dad had in his practice, he was a dermatologist, that he was beloved. And I thought that if I could help patients through, and I guess helping by the means of that I knew of at the time, the work as an oncologist, to find the cure, to find the next best medicine out there, to really nail this cancer, the fight, to win the war. That as I trained and as I learned, the focus became on the disease, and what are the markers of the disease? What is the stage of this disease? What's going on with the disease? But no one stepped back to look at the soil. Everyone focused on pulling out the weed, but then what's to keep another weed from growing back if we don't correct the soil? My dad, no one talked to him about nutrition. No one talked to him about optimal diet. And it slowly dawned on me as my training and got further and further into it that it's not the right approach. You have to treat the milieu. You have to treat the inflammatory factors. You have to get these diseases where they are. You have to starve the cancers out. There's Nobel laureate, Dr. Warburg in the 1920s found that the cancer cells rely on glycolysis as a means of non-oxidative fermentation of substrates to produce ATP. And by reducing sugar, by limiting sugar of all things, you can have a dramatic impact on the spread and growth of cancer within your cells. And that's how I got into and helped me bridge that gap. Going so far to think that I'm helping people as best as possible, and to realize that there's a better way of helping people. And there's a role for conventional medicine and acute care and traumas, and it's good that it's here. But it's misguided in its application to chronic disease. And by focusing on these root causes, and cancer being of foremost prominence, you can make huge impact in prevention and reversing the tide, and truly getting down deep to the soil and correcting that at its base core. So that's full circle how my history of cancer and my personal and professional history has brought me to appreciate and admire the approach functional medicine has for caring for the whole patient.
Well, they're going to be very much attentive. This is, of course, the reason that the whole group got started. You're going to be up there on Thursday night at the Freedom of Choice in Cancer Therapy group. 40 years now, they've been meeting those people, cancer survivors who didn't take the conventional way. And at 40 years ago, imagine where they were and how they had to step out on their own. There wasn't much medical help available to them, but they knew intuitively that the approaches that were being discussed with them by the conventional community were not going to be something that they were interested in. So the fact that you'll be addressing the group in this Western Pennsylvania area that's going to be very receptive to your message of how to deal with cancer, as well as every other doggone thing, by treating that soil, I believe will be well founded. You'll be well received up there, Doctor, on Thursday night. I noticed too that it was you and your wife and the birth of you have one child now, or you have many?
We had a second one, and the second one was born at home. Big changes in those couple of years. We had a wonderful midwife, and the whole process was a beautiful one.
It worked out the way you wanted the second time around.
That's right.
You kept them all out of there, and it was able to be pulled off just like you and your wife wanted it to be. I probably know the answer to this question, but so many of the listeners have issues with vaccines. Okay, how did you and your wife confront the issue of vaccines with now 2 children, where the conventional body was to absolutely vaccinate? And as a medical doctor, where do you stand on that?
So, if number one, we did everything by the book. We did everything as outlined by American Academy of Pediatrics, and we did as soon as he came out, we gave him the hepatitis B, and we followed it by the book. And he's been a great kid, but he's had some issues of eczema, and we always wondered in the back of our minds that contribute in some way. What we did, I think, and it gets to the core of the vaccines, is that everybody is uniquely different. Everyone has a different way of coming into the world. The fact of the matter is, if you are born vaginally versus C-section, you inherit your mother's microbiome, and this microbiome is of key importance for gut health and overall health. There's a huge concept of leaky gut out there, and this leaky gut is basically having your gastrointestinal cells intact, with 100 trillion or so bacteria in our system to help promote wellness, and we live this symbiotic relationship with these bacteria. And if we come through C-section, you don't get that exact kind of good complement of bacteria, and the deck becomes stacked against you. And you keep on going from there. The continued use of breastfeeding and the health promotion that provides. And when you introduce foods, what kind of foods do you introduce? What is the environment around you? What kind of water are you drinking? What is your genetic predisposition? Do you have this MTHFR that can, slow you down to a degree? It's in very complex. We have this set rules of how you should vaccinate, but then the individuals that are in this world are very different states. And sometimes vaccines, I think, can be one of those dominoes stacked against you that, where the randomized controlled studies of efficacy. I think it really becomes an individualized decision as to how parents and physicians and everyone should be approaching the administration of these things. And using some common sense. Hepatitis B is very much not a risk factor. As soon as you come out,
crazy. That's a crazy one there, isn't it?
Isn't.
It's a real crazy one.
And it's using wisdom. It's using a judgment. It's using a thought process. And I think that more of our research will be geared towards exploring these factors and finding out and optimizing vaccination based on individuality. And I think that there's no set schedule that fits right for everybody.
By the way, just to be complete, the first one went by the book. How'd the second one go?
Second one's not quite according to the book. We have yet to do any vaccines with her, and we're not thinking about doing it any time in the future. So it's been a different tour of duty for us, for sure.
Absolutely. Been there, done that. So happy to see you made the move. And I got to tell you that at that point with my younger ones, everything was by the book. But there came a point where the book changed. The book went out the window. And so I'm glad to hear that you've thrown the book out the window. You and your wife are pursuing a path that you'll take them as they come. That's probably the best advice to let our listeners know that you pursue, and that you more than likely welcome those patients are making those same decisions with their own children as you now begin your medical practice here in Western Pennsylvania. By the way, where's your practice located? Where are you found?
So I have a kind friend who's allowed me to get started in his office. My address is 1145 Bower Hill Road, Suite 204, in Pittsburgh, PA 15243. And our office number is 412-653-7851. And I can be found on Facebook as well, David Loeber, L-O-B as in boy, U-R, M-D. And also have an email address, Dr. David Loeber, Dr. David Loeber, L-O-B as in boy, U-R, @gmail.com.
Perfect. Well, you're going to set the trend out there. It's going to be an interesting evening on Thursday night. Folks, you don't want to miss Dr. David Loeber's appearance at the Freedom of Choice and Cancer Therapy Group. Going to be out there at the Riverside Landings in Oakmont, 7 o'clock. And I think if the months suggest it, it should be the last of the year. I'm gonna guess before they take that summer break. So, Dr. Loeber, hope you have an enjoyable time out there. Try to make it myself if I can meet you person to person. You're going to do just fine. Thanks for coming aboard today, and enjoy having another member in the club.
All right.
All right, Doctor. Thank you.
Take care.
Mm-hmm. There you have it, folks. Dr. David Loeber. He is the guest speaker out there at the Freedom of Choice and Cancer Therapy Group. You want to be out there and enjoy meeting this young gentleman who looks like he has it right, doesn't it, folks? He got it right. All right. We're going to be on out of here in the next few minutes. Don't forget, on Wednesday, Dr. Susan Smith-Jones is going to be our guest. We'll have Minkoff here coming up. If you have an interest in eye programs, whether it's for retinal diseases or cataracts, this is about the right time. This is probably the last week to really be able to get your records in so that we can have a liftoff on the 22nd, which is unencumbered. We've got to send these records, by the way, down to Dr. Edward Condrat. He is involved with every case, and this usually is the week that we got to make those decisions. If you think you'd like to be a part of it, give us a call at 724-993-0500 and talk to Sister Sarah. All right, it's about time to get on out of here. Bill will be playing those crazy chopsticks in just a moment. So let's say I'll be looking forward to seeing you on Wednesday. Until then, this is Dr. Dennis Courtney saying so long for AM Impact on Your Health.